Sessions for the JSU Student Symposium. Today I have Meagan Chastain, and she'll be talking to you about comparing long-term outcomes in fresh versus frozen meniscal allograft transplant. Thank you.
So as she said, my name is Meagan Chastain, and today I'm going to be talking to you about comparing the long-term outcomes in fresh versus frozen meniscal allograft transplants, or you'll see it as MAT referred to in this PowerPoint. So just a quick little introduction about the meniscus. So the meniscus sit in between your thigh and your shin, so like right in that kneecap. And some of the key functions are flow distribution, shock absorption, joint lubrication, and stability and proprioception. A little bit about the structure of each side of the meniscus. Your medial meniscus is less mobile, and your lateral meniscus is more mobile, which is secondary to axial or rotational loads. So meniscal tears are very common soft tissue injuries that require surgery, and the goal of this surgery is to delay degenerative changes in symptomatic young patients. The two graft types that I'm going to be talking about today are fresh versus frozen. And some challenges that I came across were that there was limited data on return to sport and long-term durability for athletes. Just a few implications for this surgery. So the ideal patient is young, healthy, and active, so in between the ages of 30 to 50 years old. They have to be symptomatic after a prior meniscectomy, which is just a surgical removal of a meniscus. And you also have to have failed non-operative treatment, which is basically just physical therapy. And then some of the primary goals in MAT, like I said, to delay degenerative changes, but also restore normal knee function. Some challenges in this surgery occurred in patients that were older than 50 years old because of the higher failure rates and higher risk of knee arthritis and other comorbidities. A few contraindications were inflammatory arthritis and obesity. So moving on into the fresh grafts, these had superior tissue viability and a short procurement window. So these are harvested and transplanted about 12 to 24 hours post-mortem. These have a higher cost due to many different factors. One of these is time sensitivity. So as you can tell, it's 12 to 24 hours, so it requires a quick coordination between the donor and the facilities, the surgery centers. You can also have a higher cost due to the limited availability. So again, the strict timeline reduces the number of the potential donors, which can make the grafts less accessible. And also storage requirements. These grafts require immediate refrigeration and cannot be stored long term. Moving on to the frozen grafts. These are more practical and cost effective just due to the longer shelf life. These include rapid freezing with no cryoprotectants. Cryoprotectants really just prevent the freezing damage to any tissues. So a good way to think about this is if you put like food in the freezer or refrigerator without like Tupperware or plastic wrap, anything to protect it. These grafts are also viable up to 5 years, and these have a lower cost due to the longer shelf life, which allows for bulk processing and storage. So moving on into my focus clinical question. In all, my question is, in the active population with meniscus tears, does a fresh meniscal allograft transplant or deep frozen meniscal allograft transplant have better long-term outcomes? So as you can see in this PICO question, my population is the active population. The intervention that I'm evaluating is the fresh meniscal allograft transplant compared to the deep frozen meniscal allograft transplant, and the outcome that I wanted to evaluate was long-term outcomes. These are some of my search strategies that I use. I used the GemFinder and PubMed databases. The search terms I used were meniscal fresh allograft transplant and knee function following meniscal transplant. Some inclusion criteria that I used were published between 2013 and 2024 and in the English language. Some exclusion criteria that I used were case studies just due to the lower level of evidence, geriatric and sedentary populations, and short-term outcomes of MAT. And my search produced 114 total articles, but I used 5 main articles to answer my clinical question. This is my evidence quality assessment. So as you can tell, I used the Prisma scale for systematic reviews and the strobe for cohort studies. And as you can tell, these are scored very highly, which indicates a higher level of evidence. So these are my results. Fresh grafts had over 70% survivorship at 10 years post-op and had better long-term outcomes with reduced knee pain and improved functional scores. The frozen grafts had a lower long-term durability with failure rates ranging from 10% to 29%. This also had high patient satisfaction, but also had more challenges in the long-term outcomes. Now I wanted to move into strengths and weaknesses of each graft. So first I wanted to talk about the fresh grafts. Some strengths of this graft are that it has higher survivorship with over 70% at 10 years in ideal candidates. So that goes back to the 30 to 50-year-old candidates. And it also had reduced knee pain and improved functional scores at the final follow-up. Some weaknesses include the limited availability due to the shorter shelf life, and that requires quick processing post-donation. And it may not be as widely accessible as frozen grafts, which can also limit treatment options. Moving on into the frozen grafts, the strengths of this graft was that it was more accessible and easier to store, which makes them more practical for a greater number of patients. Also had a longer shelf life, which allows more time to utilize the graft. The weaknesses of this was while it may be more practical, it also resulted in slightly less optimal recovery. And it also may result in poorer clinical outcomes over time compared to the fresh grafts. My clinical bottom line is that meniscal allograft transplants offer significant benefits for managing meniscal injuries and preserving knee function. Fresh grafts provide better outcomes in pain relief, functional recovery, and knee biomechanics. And frozen grafts are a more practical choice due to the longer shelf life and accessibility. I wanted to talk a little bit about implications. So my first implication is for research, and this includes investigating long-term outcomes of fresh versus frozen grafts with a focus on return to sport or return to play for athletes, exploring biomechanical impacts and patient-reported outcomes for athletes post-MAT, and studying the cost-effectiveness and economic impacts of the graft choices. My next implication is for the athletic training profession as a whole, is to stay informed on MAT outcomes to assist in rehabilitation, focusing on pre-op education for athletes, so talking about risks, benefits, and recovery, implementing evidence-based rehabilitation protocols for athletes post-op, and then for athletic training students, integrating surgical procedures and specific rehabilitation in the curriculum, encouraging collaboration with surgeons for optimal recovery outcomes, and staying up to date on surgical techniques for better rehabilitation strategies. And here are my references. And I just wanted to say thank you to the Student Symposium for allowing me to present today, and my professors in my cohort for supporting me throughout this research, as well as my graduate degree. And then I also wanted to thank my family for supporting me as well. Are there any questions?
Yeah.
How do you decide which one to get, or who decides which type of graft to get?
So at that point, you would really talk to the surgeon and the patient and kind of decide from there what graft you would want to go for. So ultimately, it would be up to the surgeon and the patient. Yes.
Okay, for somebody who's uneducated in this field, what's the benefit of using a fresh graft over a frozen graft and vice versa? What's the benefits?
So for the fresh graft, I think those are better for the younger patients that still want to, especially athletes who want to continue playing in their sport. So while it may not have the best outcomes at first, once you get through rehab and all of that, it will have better outcomes than the frozen one.
So a non-athlete may choose the frozen graft.
Correct.
Okay.
Any other questions? If not, another round of applause.